Practitioner Posture. So best posture for doing zone therapy is to have both feet flat on the floor, nice straight back, and you want to have your client's feet at your shoulder height. So things that won't work are having your legs crossed, putting your feet on the wheels of your chair, tucking your legs underneath yourself. You always want to have those feet flat on the floor and a straight back. So when your client is on the table, ideally you will have their feet at your shoulder height. You will have one bolster under the client's knee and you'll have another one just above their ankle. So that supports the leg really comfortably for the client, and it also means that you've got this part of the foot free so that you can access all areas of the feet for the zone therapy treatment. Effleurage. Using both hands, move along the top and the bottom of the foot. So this is a connecting stroke and a warming stroke, and it's used to increase that circulation into the feet. Traction. For this technique, you're using both your hands again. So cupping the heel with your hand and just supporting on top of the foot here. And for this technique, you stand up and lean back slowly. So you're using your body weight to gently stretch and release the client's ankles. Hold for about 4 to 5 seconds, then gently release for a few seconds again. And you can repeat this technique a few times as necessary. So as you pull back, you count 3, 2, 1, and gently release. 3, 2, 1, and apply it again. 3, 2, 1. Rolling the ankle. Support your client's foot under the heel with one hand, and with the other hand hold the ball of the foot. So that's this area here. Make sure you're not up on the toes. You're not going to get a lot of the ankle roll action happening there. You need to be holding in the ball of the foot. So gently roll the foot around in a circular movement. So outwards and inwards. And you can see the whole leg is moving. That's the action you want to see. So then also moving from inwards to outwards, going through the full range of your client's motion. Flapping. This is where the practitioner places a hand either side of the client's ankle. You can see how the malleolus just fits nicely into that part of the palm. So either side of the client's foot, and you want to have a waving action. So the foot is flapping. This technique is the spinal twist, and the focus of this technique is on the instep of your client's foot. So from here upward, anything from here downward relates to the pelvis. So using your hand, one hand as a base, and the other hand comes around the top like this, and just applying a twisting action. So as you move up towards your client's toes, bring both hands with you so they remain together. And the action for this technique is coming from the top hand only. So twisting both ways, moving up the foot millimetre by millimetre, and stopping when you reach this area that corresponds to the neck. This technique is the lung press, and the focus for this is on this area just underneath the toes. That's the area relating to the lungs. So what happens is making a loose fist and just pressing that into the client's foot as they breathe in, and as they breathe out, squeezing the foot. So you can see here there's a fold in the foot. That's what we're looking for. So when the technique is applied, it will look more like this. So the client breathes in, pressing in, as they breathe out, squeezing the foot, but keeping the fist in that area. As they breathe in, pressing the foot, as they breathe out, folding that in again. Now some of you may come across really large feet, So that's when it's okay to use 2 hands to achieve that crease, and then just flow in with that fist in that lung area.